the update of the National Emergency Response Committee on Coronavirus. This is our 153rd brief. And today we would like to focus on immunization services. Immunization services are extremely crucial when it comes to ensuring that we are defeating maternal deaths and childhood deaths in the country. And most particularly because universal health coverage and immunization services are fundamentally intertwined, as they both contribute to diminishing health inequalities, they both contribute to reducing poverty, they foster inclusion, and they catalyze economic growth. Now, through the implementation of the National Immunization Program and with the collaborative investment of development partners, Kenya has made substantial gains when it comes to childhood and maternal diseases, most particularly in noting that maternal and neonatal tetanus disease, as well as wild poliovirus, have been eradicated in Kenya. And this is through continuous investment in immunization services. Now, a scaling of these joint investments has seen a further expansion of our immunization programs through the introduction of 6 new vaccines in the past decade, all of which continue to contribute to the reduction of childhood diseases and deaths. These vaccines, amongst them, the vaccine against cervical cancer, amongst them, rotavirus, amongst them, pneumococcal vaccine, are all available free of charge through a network of 9,500 health facilities across the country, teaming with facilities from the public, private sector, faith-based facilities, as well as NGO organizations. The Ministry of Health continues to sustain its investments in immunization services, and we take note that at least in the year 2019, we were able to attain a national average of 83%. However, in the age of COVID-19, we do note a decline in the absolute number of children who are vaccinated, and this has been observed, of course, due to disruption brought about by coronavirus. And when we compare the same time period this year compared to last year, we are noting that we have a 2.34% dip. Last year, we had about 640,000 children immunized as at this time. This year, we've shaved off about 20,000, coming to around 600,025 children vaccinated this year. In addition, we've also noticed a dip when it comes to the HPV vaccine for 10-year-old girls, which currently stands at a coverage rate of 46%. And so in the age of COVID-19, we continue to remind all Kenyans and to inform them that immunization services are ongoing and are available across all our healthcare facilities, and that the vaccine schedules as delivered through the National Immunization Program are there and are available. We continue to encourage parents and guardians to ensure that their 10-year-old girls have received at least the 2 doses of the HPV vaccine, and for our infants that we ensure that they complete their vaccination schedule, particularly targeting to ensure that all infants have received 2 doses of the measles rubella vaccine by the time they are 2 years old. Now, turning to the issue of COVID-19 and vaccines and immunization, Kenya continues to engage in different negotiations and discussions, most noting our permanent mission in Geneva that is contributing to these discussions and is in consultation with a global umbrella facility body known as COVAX. This is a body that is coming together under the stewardship of WHO and Gavi to ensure that vaccines are availed at a cost that is affordable to countries, and most particularly to ensure that there is equitable distribution when it comes to vaccines. Yesterday, we promised you that we shall continue to share with you information when it comes to the epidemiology of this disease. We've been getting continuous questions as to where we are in the curve, and we shall continue to share with you that information. Today, we would like to focus on a key area when it comes to defining the epidemiological curve of a disease, and that is the caseload and the positivity rate. And so today's brief will focus on that, and as we continue our daily briefings, we'll be able to share more epidemiological data. In that regard, as at yesterday, we had a caseload of about 30,000 confirmed cases. And what is important to understand is that from this caseload, out of our sample sizes, the current positivity rate in the country stands at 7.9%. And over the last 34 weeks, this positivity rate has steadily increased from an initial 2%, if you remember, at the beginning of the epidemic, to the current 7.9%. And this increase points to an acceleration in the rate of transmission of the disease. And this perhaps is the first answer to the question that we had yesterday as to where are we on the curve? Are we flattening the curve? Despite recording new lower numbers, where are we? And if we were to look and extrapolate this 7.9% positivity rate, it would mean right now in the country, assuming a population of about 47 million, it would mean that we have about 3 million cases. Again, if we look at the change in positivity rate from the beginning of this pandemic to where we are today, it points out that the curve is not flattening. And this will be shared with you in terms of the graphs and figures that we've shared with you to show you that the curve is still peaking. Now, as we, try and understand what does it mean then for Kenya to have a positivity rate of 7.9%, we've been able to look at different global benchmarks across the world, benchmarks that point to, what is the acceptable positivity rate. At what point will a positivity rate tell us that we are actually, able to stamp down this curve? And global benchmarks by WHO tell us that when a country records a positivity rate of at least 5% or lower over a period of 14 days, then indeed we are getting to the point where we are able to flatten this curve. And as you can see, today we stand at 7.9%. And so we are continuing to ensure that we manage this pandemic and get to that global benchmark of 5% for 14 days. Now, turning on to our COVID-19 statistics today, 426 people have tested positive out of a sample of 5,158 samples collected within the last 24 hours. And this now brings the country caseload to 31,441 number of positive cases. And from all these cases, all are Kenyan except 9 of them. In terms of disaggregation, we have 239 males, 187 females, with the youngest being a 3-month-old infant and the oldest is 88 years. In terms of distribution by county, Nairobi leads with 132 cases. Kajiado has 63, Kericho 48, Kiambu 24, Machakos 21, Migori 17, Mombasa 16, Kitui 13, Laikipia 13. Both Nakuru and Kisumu have 11 cases. Uasin Gishu has 10, Tharaka Nithi 8, Nyeri Busia 7, Makueni 6, Kilifi 4, Garissa 3, Nyandarua 3, Isiolo and Embu both have 2 cases, whereas Meru, Kirinyaga, Kakamega, Baringo and Lamu all have 1 case. We continue to provide you with a disaggregation by sub-county, and that will be shared with you, where you can see which sub-counties have the highest number of cases per county. With regard to recovery, we have 257 patients that have recovered from the disease, with 195 from the home-based care program, whereas 62 have been discharged from various hospitals. And therefore, our total number of recoveries stands at 17,869. And we continue to thank all the frontline healthcare workers for the good job that they're doing. On a sad note, today we've lost 10 patients to the disease, bringing our fatality to 516. And of note today is that 3 of these deaths are actually community deaths. And I think the DG will speak to the importance of ensuring that you actually seek care, promptly. And again, interesting to note is that these 3 deaths are actually, I think, below 30 years old. So it means that there's a problem there when it comes to seeking health care amongst the young population. We do extend our sincere condolences to families and friends of those who've lost their loved ones. Thank you.
My name is Dorcas Wangera from Citizen TV. Healthcare workers continue to raise several grievances. Like today we had different cadres talking about having lack of PPEs, not getting their allowances from the ministry, also issues of healthcare workers who have underlying conditions and some who are expectant, wanting to be exempted from work. What will be the ministry's intervention? Even Nairobi's healthcare workers had threatened to down their tools, and you've mentioned healthcare workers are doing a good job, but they say that their grievances are not being heard. And then secondly, about the positivity rate, you talk about 7.9%. So in terms of what will it take to get to this 5%? Because you're already seeing there being restrictions with travel. Will there be stiffer measures?
Good afternoon. I'm Purity myself from KBC. I would love to know whether the virus is mutating in terms of the spread of the virus, because there are so many people coming out, testing positive, yes, but their spouses who they live with are negative. How do we explain that?
My name is Beldin Oliola from KTN. I want to ask, to what extent is coronavirus causing deaths in the country, put differently compared to previous years at this time? How many more or excess deaths are we recording during this corona outbreak? And number two, the DG, you promised to give us data on the infection rates and recovery rate of infants and older people. And also still, people are still complaining that the coronavirus tests delays, they're still experiencing that. Maybe what's the Ministry of Health doing?
Zainab Mohammed, TV47. We know that Nairobi doctors' strike notice will be expiring today at midnight. What is the ministry planning to do about that?
My name is Philemon Kimayo from NTV. The Council of Governors has raised the concern that test results are taking up to 1 week or more to be delivered. What does this say of contact tracing headache that this causes?
Thank you for that question, and I'll combine that question with a similar question that has been asked by Beldina concerning the delay in testing. Yes, there are delays when it comes to, sharing some of the COVID-19 results. These delays have been occasioned both in public and private testing facilities. There are challenges when it comes to ensuring, like we've previously said, that running a test, if I took samples from you here standing in front of us today, I may not actually be able to do a complete run because I need 94 samples to be able to do a successful run. So what this means is that every time we're doing sample collection, we have to have a very efficient and agile logistics system where we are batching samples to be able to get the requisite 94 samples to then enable the machine to do the run. And it's important that that is understood, that, the COVID-19 test is not conducted on individual basis. Just because you take Mercy's test doesn't mean that Mercy's test will now be run at 10 o'clock and Mercy will get her result at 6 p.m. No, we have to batch 94 tests and then run those tests as a set. And because of challenges in ensuring that we are doing that, there are teams working to facilitate that, to expedite that, to ensure the batching is done in a manner where in a day we are actually able to run the samples that we collect. And that is why we have delays, and the DG, I'm sure, will be able to explain further as to how we are attempting to reduce that time delay. It's important to know that this delay is not just in public facilities. We've received and had discussions with private testing facilities, and they too have challenges in being able to batch and ensure that samples can be collected and results received at the same time. Again, interestingly, this is not just a Kenyan challenge. This is actually happening across the world. Just last night, I was in communication with people from America, and they've been waiting for their tests for a week. So it is something that is happening across the world. Remember, this is a new disease. We are learning as we go. We are improving as we go. And that's important to remember. When it comes to looking at the excess deaths, there's been a question from KTN. How has COVID contributed to the current mortalities that we have? Like we mentioned previously, we've activated what we are calling sentinel surveillance sites across the country. We have 20 of them. These are hospitals. These are particularly level 4 hospitals who are able to record and tell us, is there any excess mortality when it comes to COVID-19? Most recently, I'm sure you've seen a report released by KNBS looking at different causes of mortality last year up to early this year in terms of the financial year. And we're looking forward to see the assessments that we are conducting at these sentinel surveillance sites. Will they be able to give us a clear quantitative answer as to whether we have more deaths or not? When we routinely look at our systems of reporting death, and this is the routine manner, of deaths being reported, we have not yet seen a spike or an increase in deaths. However, for us to be able to say, and to say it scientifically, in a manner that we can stand by it because it is done scientifically, we currently are in that process of doing that assessment to determine if we have any excess deaths. The other question that was asked was by Purity in terms of having one sort of member of a couple test positive and another test negative. This is actually not a new phenomenon when it comes to diseases. If you all remember, with HIV, we used to have what we called discordant couples, where one couple is positive and another is negative. And there are many reasons as to why you can get the situation of having discordancy. As couples, and particularly not just couples, even in a household, you could find that the father is positive. The father, is there day in, day out, spends time with the children and the mother, but some of them are negative. That again is discordancy. Right now, we cannot attribute mutation of the virus to discordancy. Sometimes when we look at how this disease is evolving, we are noting that perhaps within that household, somebody could have been in the recovery process earlier than another member of the household. So really this is something, again, that's under investigation the world over to determine exactly what happens for household units who are living together, particularly when you have cases of discordance. So Purity, it's not a case of mutation. It is a phenomenon that has been seen with different other viruses, and we are continuing to study to understand it. Some of the answers are that one member could actually have been contracted the disease earlier and have recovered. So that's one of the plausible explanations for that. The other question that comes in is on the positivity rates, and here the DG will help me in terms of trying to explain to you that yes, our positivity rate is 7.9%. Yes, the global benchmark is to try and get it to 5%, but not just 5%, but 5% for a continuous 14 days. And for us to be able to do that, it all goes back to the three things we've often talked about: wash your hands, mask, observe physical distancing. Of course, with continued testing, we will see an increase in this. And so we continue to really emphasize on that responsibility of adhering to those three measures. Now, the question of healthcare workers has been asked by several members from the Fourth Estate. Again, a question on lack of PPEs, a question on exemption when it comes to conditions. One, it's important to note that the Office of the President did release a circular when it comes to shielding the vulnerable in the community. And yes, pregnancy is one of those conditions that would require special conditions in terms of COVID-19, and also other conditions that healthcare workers may have. We have healthcare workers who are diabetic, who are hypertensive, who then require to be reprogrammed. Those who can work from home can work from home. Those who can work from low-risk areas can work from low-risk areas. With regard to PPEs, we continue to inform you and to insist that PPEs are there, they are available. Yesterday we had a question on the quality of PPEs, and we've really articulated to you that there are mechanisms where we assess the quality of these PPEs, and should there be any set that is of poor quality, send it back to us. There will be replacement at no cost. And we've emphasized on that over and over again. Grievances, we continue to engage with the union. We're in discussion with the NMS team that is handling this issue to ensure that the grievances are met. I'm aware advanced steps have been made, and I've consistently mentioned that at least pertaining to the insurance cover, that is under negotiation. NHIF is in the process of doing an actuarial process of what it would cost. The budgets are there, they've been availed. When it comes to PPEs, those are available. When it comes to providing quarantine facilities, Our quarantine facilities here are available for the doctors working under NMS. When it comes to dealing with issues of payroll, there's a process. Remember, we require the payroll to be transferred from Nairobi County to NMS, and that is a process that is underway, so that we can look at the issue of promotions and allowances. When it comes to COVID-19 allowances, all allowances have been paid, and we have that information to back that up, and that is important to note. I'll ask the DG to really add on to the issue of positivity, the epidemiology of the disease, and any other issue. Karibu, DG.
Thanks, Madam CS. Let me start by the issue about the test and the turnaround time. Of course, you have seen our figures for the testing have gone up. I think now we have done more than 400,000 tests. But of course, with this, we have always experienced challenges, which we have always shared with you. Like as of today, 4 of our labs are down with a capacity of more than 1,600 tests in 24 hours. So definitely that leads to a delayed turnaround time, because even the other labs where we send the extra specimens have a given capacity that we cannot be able to exceed, especially in terms of batching. So as of today, the National HIV Reference Laboratory, the NIC laboratory are down. Our mobile lab in Namanga and the dry port in Naivasha are down, but we have already put measures into place to ensure that these labs are up and running within the next 24-48 hours. So that would account for a delayed turnaround time. In terms of contact tracing, we have said over and over again that this is a science. It's important that we do contact tracing, especially where we don't have established community transmission of SARS-CoV-2. And contact tracing starts by first identifying the contacts, those who have come into contact with a positive case or a suspected case. Then we put them in what we call a line list. Then we do contact follow-up, which can be passive, meaning that you just talk to them, explain to them the symptoms that they could be able to get in case they become symptomatic, or active, where you follow up each and every day to see if they develop those symptoms, and therefore thereafter contact discharge. We still maintain that these are important processes, especially in counties where we don't have established community transmission. Like West Pokot, Elgeyo Marakwet, we are still reporting very few numbers. If we do aggressive contact tracing, we can actually stamp out the transmission of the virus entirely. Question 2 was regarding excess mortality, a very good question and very important. To be able to tell us what is happening at community level. More so that we have not done a national seroprevalence survey of the disease, to be able to tell us the exposure level of SARS-CoV-2 in community level. We are working closely with the Ministry of Interior and our modeling team are trying to pour through the data to be able to tell us whether there is excess mortality. This study has only been done in one country in Africa, South Africa, where they found a 4-fold increase in deaths during SARS-CoV-2. Of course, not all those deaths can be attributed to coronavirus, because fear and stigma of going to the hospital means that you could also die of other conditions if you don't go to the healthcare facility. We'll be able to share this data with you once our modeling team, working with the Civil Registration of Vital Statistics, have poured through the data to be able to give us what it looks like. In terms of numbers of people infected, age group 0 to 9, there's that question about infants. That forms about 4.5% of the entire caseload, at about 1,400. Of course, I cannot be able to break this one down into 1 year, 2 years, because the number is very, very small. But the biggest proportion of our caseload is people aged 30 to 39 years, which is about 33% of the total caseload. Question regarding discordance, I think Madam Waziri articulated that very well. But remember, how you get corona depends on so many things. One of them is the dose of the infectious agent. It means if you are symptomatic and shedding a very huge load of the virus, it means then if you come into close contact with somebody, you are likely more than ever to be able to transmit that infection to somebody who is in the recovery phase and therefore shedding less of the virus. Number 2 is the proximity, and this is the essence of the physical distancing. if I'm too close to you, less than 1 meter, the chances of the droplets not falling down, therefore being transmitted to you directly, then puts you at a great risk. Number 3, of course, is the duration of the exposure, and that is why we say if you are in a closed environment where you may not be able to maintain physical distance, please ensure that you take the shortest time possible. And of course, the final one is your level of immunity. As was explained by Madam Waziri even during the HIV pandemic, that there are those who could be able to get the virus and they are immune and they are serodiscordant. So it is important to maintain all these measures that we put in place, and this is what is going to help us ensure that our positivity rate is less than 5% over the next 14 days or whichever time that comes, that we can be able to clearly state that our curve is flattening. So the measures remain the same, that you must ensure that you wash hands, you sanitize, you mask properly, you don't leave your mask on your chin, and of course you maintain social and physical distance. No case of the virus mutating reported so far, but even if the virus was to mutate, it could be either way. It could make it more virulent, more infectious, more dangerous, more lethal, but also studies have shown that viruses can also mutate into less virulent strains, like happened with SARS in 2003. Initially the mortality rate was very high. When the virus mutated, it mutated into a less virulent type, and therefore the mortality rate went very, very low. And that is why many people didn't even take the SARS virus vaccine in 2003. We will continue to celebrate the healthcare workers for the wonderful job they have done under very difficult circumstances. As of today, 854 of them have tested positive for SARS-CoV-2, with 450 being males, the rest being females. This puts the positivity rate for the healthcare workers at 2.9, which is fairly low compared to the global average of 10%. Of course, one healthcare worker exposed is one too many. We will continue to work together with them to ensure that they have adequate PPEs, ensure that we have done capacity building so that they know how to use the PPEs properly, practice infection prevention control measures, and also not only at work but back in the community. We have also recorded 15 deaths of healthcare workers. Again, our hearts go to the families, relatives and friends of our deceased colleagues. That gives a mortality rate of about 1.8, which compares very favorably with the national average case fatality rate of 1.6%, but less than the global case fatality rate of 3.6%. Thank you.
Thank you.
Na bila shaka mpenzi mtazamaji, ndo taarifa kila siku kuhusu msambao wa virusi vya korona nchini, ikiwa siku ya leo visa hivyo vimeweza kuongezeka, na hivi sasa ndo tunang'oa nanga na taarifa za shina la upeo, ili uzidi kumakinika popote ulipo mtazamaji. Wakwetu wananiita Joashon Sare, na bila shaka tunaanza moja kwa moja tuweze kukujuza ni yepi ambao yameweza kutokea, ambapo watu 426 wameweza kuripotiwa kuwa na virusi hivi katika kipindi cha saa 24 zilizopita, na kufikisha jumla ya visa 31,441. Vile mtazamaji, watu 10 zaidi wameweza kufariki kutokana na virusi hivi vya korona. Vile mtazamaji, watu 257 wameweza kupona virusi hivi vya korona. Mtazamaji, taarifa hizi unazipata live kupitia ukurasa wetu wa Facebook TV47 Kenya. Ingia kwenye Twitter @TV47KE, na vile vile weza kuingia katika ukurasa wangu wa Twitter Josh Onsare, wa kwetu wananiita Joash Onsare. Tunasonga mbele, na ni kwamba wahudumu wa afya wamesitisha mgomo wao uliokuwa unatarajiwa kuanza leo. Wamesema kuwa wameipa serikali makataa ya siku 21 zijazo kabla ya kuanza mgomo huo. Makataa waliokuwa wametoa kwa serikali yamekamilika leo, na mgomo wao ulitarajiwa kuanza leo usiku. Kulingana nao, kwa sasa ni siku 90 tangu waiandikie barua serikali kuhusu matakwa yao. Katika taarifa ya pamoja, viongozi kutoka miungano mbalimbali ya wahudumu wa afya wamesema kuwa kufikia sasa wahudumu wa afya 850 wameambukizwa virusi vya korona, kati ya visa zaidi ya 1030 vilivyoripotiwa na kati ya watu zaidi ya 500 walioaga dunia. 16 kati yao ni wahudumu wa afya. Serikali imeagizwa kuharakisha zoezi la kuajiri wahudumu wa afya ili kuzidi kupambana na janga hili la korona.
It is on a sad day that we want to say we want to stop lamenting and we want to act. In this manner, over 17 healthcare workers, cadres, have resolved unanimously to issue a strike notice in the context and the manner that I will be able to read. But before then, let me make a very important remark. They have 3 months down. They have not paid members. They're still intimidating healthcare workers. We are already stressed, and we have enough to bear with. Not any intimidation. Vihiga is another case. We have Vihiga County, which have not paid over 787 healthcare workers for 9 months. This is the pain that we have. And we are experiencing the pain in a manner that our members are going several months without any pay. They are not able to meet, to eat, to buy food, to commute to work, and even to dress properly as professionals. We have to say that it has come to the time that it must end. It is a time when we have a ministry that has received numerous contribution, donation, and even funding from the government. But nothing is reflecting on the ground. We do not appreciate as the practitioners. Nothing is happening. The announcement by Mr. Mutahi Kagwe, Honorable Mutahi Kagwe, who is the CS, does not actually bring the picture on what is happening on the ground. The healthcare workers are working under very dire situation. They said they were to test people for that.
Na bila shaka mpenzi mtazamaji, taarifa hiyo inatayarishwa ikifika saa 1. Mwanahabari wetu Zainab Mohamed atakuwa na kudadavulia taarifa hiyo kwa kina zaidi. Sasa tubadilishe dira, tuangazie masuala ya elimu, na ni kwamba waziri wa elimu Profesa George Magoha amezuru eneo la Magharibi kukagua utayari wa vyuo vikuu. Mapema leo ametembelea chuo kikuu cha Masinde Muliro kukagua kujiandaa kwa chuo hicho kwa kurejelea kwa shughuli za masomo. Waziri Magoha amesisitiza lazima vyuo vyote vitekeleze masharti ya Wizara ya Afya kabla ya kupewa idhini ya kurejelea masomo.
So what I'm going to ask the most fraternity is to stop petty politics, which actually count for nothing. This is an excellent academic institution with excellent faculty. I must say that occasionally I've heard from people like my brother, the union leader, Professor Kubasu, who has risen above all this petty politics. Can we focus on the institution itself? Let us focus on the institution itself, not the people inside it, and just do what we have to do. By the students' interaction, they have actually engaged me on issues, not politics. So the people who are confusing here are some of the people in the faculty who want to. This is the National University. Who has told you that this is the county university? The National University, that is one of the top ones. Yes. Can you allow us to nurture it, to even get to another level?
Na tukisonga mbele ni kwamba maafisa wa tume ya kupambana na maadili na vile ufisadi kwa sasa wanafanya msako nyumbani kwake gavana wa Kirinyaga Anne Waiguru hapa jijini Nairobi. Hii ni baada ya kufanya msako katika nyumba yake eneo la Kirugoya. Hatua hii inafuatia amri iliyotolewa na mahakama ya Nyeri kuruhusu EACC kukagua madai kwamba Waiguru na maafisa wengine wa kaunti walipokea shilingi milioni 23 zilizodaiwa ni za safari ambazo zinatiliwa shaka kama zilifanyika. Mwanahabari wetu David Muthoka sasa aliweza kuzuru eneo hilo na kutuandalia taarifa ifuatayo. Na bila shaka mpenzi mtazamaji, ni taarifa ambayo utakuwa unaipata ikitimia mwendo wa saa 1 jioni. Hivi sasa tunasanzuka na ni kwamba gavana wa Murang'a Mwangi wa Iria ametoa kandarasi kwa Mungai Gathogo, mkazi wa Kiambu, kutengeneza vitanda 100 kunradhi vya wagonjwa mahututi. Gavana wa Iria aidha amesema serikali yake imeweka mkataba na Mungai ambapo anatarajiwa kuwapa mafunzo vijana kutoka kaunti ya Murang'a jinsi ya kutengeza vitanda hivyo. Gavana wa Iria ni wa 3 nchini kukumbatia agizo la Rais Uhuru Kenyatta kununua vitanda vilivyotengezwa nchini baada ya kaunti ya Kiambu na Lamu kufanya hivyo.
And I want to assure you that as Murang'a County government, our governor is very committed to support you and is willing to work with you and is already authorized that we order 100 beds from you, which we are going to do. And we want to say that we will work together and make sure that we fight COVID as a team.
I've received the certificate from Kenya Bureau, which is now allowing us to do mass production of the beds. And we are glad that during that period of production, we are starting with 65 people who will be working on the workshop.
We would like to thank the governor of Murang'a for giving us this chance to be here in Murang'a today, to come present to him the bed we have there.
Na tukizidi kufululiza na taarifa ni kwamba watu 93 kutoka eneo la kati ya nchi wamejitoa uhai kwa muda wa miezi 6 iliyopita, 84 wakiwa wanaume huku 9 wakiwa wanawake. Kulingana na kamishna wa eneo hilo Patrick Lumumba, idadi kubwa ya visa hivi vimeripotiwa kutoka kaunti ya Kiambu na Kirinyaga, huku vingine vikitokana na vita vya kinyumbani na mimba za mapema.
This year, up to date, we have had different cases from different counties. From Nyeri, we have had a total of 17 suicide cases. From Kirinyaga County, up to date, we have had 25 cases. From Murang'a, we have had 16 cases. From Kiambu, up to date, we have had 25 reported cases. And from Nyandarua, we have had 9 cases. Those are reported ones. There may be others which take place which have not been reported to us, but the figures, the breakdown I've given you is for the reported cases which we have received.
Na mtazamaji, taarifa hizi unazipata live kupitia ukurasa wetu wa Facebook TV47 Kenya. Ingia kwenye Twitter @TV47KE, ukurasa wa kwangu @Josh Onsare, ili tuzidi kuzungumza kadri tunavyozidi kusonga mbele. Mtazamaji, ni kwamba serikali imewahakikishia Wakenya kuwa anga ya nchi ipo shwari na Wakenya kutokuwa na wasiwasi wowote. Akizungumza katika eneo la Ngomeni, kaunti ya Malindi, waziri wa ulinzi Balozi Monica Juma, ambaye yupo ziarani eneo hilo, amesema kuwa serikali imeweka mikakati dhabiti ya kuhakikisha anga ipo shwari. Waziri Juma alikuwa ameandamana na maafisa wengine kutoka Wizara ya Ulinzi na Usalama.
To Kenyans is to tell them that we are part of the countries that are most respected, that are providing global leadership in this and other areas, including peace and security. You know that we are assuming our seat in the UN Security Council in a short while, from 2021 to 2022. And this region, the Horn of Africa, the Indian Ocean Rim, is one of the key areas. And so to tell them that we are here, the country is secure. The big issue right now, of course, is COVID, and to call upon everyone in our territory to take all the measures that are necessary. This is something we can beat. It just requires following through the protocols that are being advised of us by the Ministry of Health. And as you have seen, we are able to get to a stable plateau. And we need to not just get to a stable plateau, we need to recede the threat of COVID by changing the behavior.
Na sasa tuelekee katika kaunti ya Nyandarua. Ni kwamba ripoti iliyotolewa na tume ya idadi ya watu na maendeleo nchini inaonyesha kuwa wasichana wapatao 857 walio kati ya umri wa miaka 10 hadi 19 wamepachikwa mimba mwaka huu katika kaunti ya Nyandarua. Kufuatia haya, mwakilishi wa kina mama katika kaunti hiyo Faith Gitau ameomba wazazi kuwachunga watoto wao, haswa kipindi hiki watoto wengi wako nyumbani kufuatia virusi vya korona. Alitoa msaada wa sodo kwa wasichana wa eneo hilo na amesema kuwa wahusika wa vitendo hivyo watachukuliwa hatua kali za kisheria.
Watoto wako nyumbani, lakini hata wazazi wako na responsibility yao ya kuchunga hawa watoto, kwa sababu unajua sasa vile wako nyumbani hakuna kazi wanafanya. Kwa hivyo hawa watoto wanachenga wazazi, wanaenda kuzurura.
Kama serikali inaweza kutusaidia hawa watoto wawe wakisomeshwa na walimu wale wako area hii, tungefurahia sana.
Hata hao watoto ambao walipata mimba, wale wanataka kurudi shule, mimi kama mama county I will ensure wote wamerudi shule, kwa sababu lazima wasome na wajitegemee maisha yao ya usoni.
Na sasa mtazamaji, tunapaa kutoka Nyandarua hadi kaunti ya Kilifi, na ni kwamba washikadau katika sekta ya utalii katika kaunti ya Kilifi wameandaa maandamano dhidi ya serikali kwa kutowashirikisha katika mgao wa shilingi bilioni 3 zilizotengwa kwa msaada wa kupambana na janga la korona. Wakiwemo madereva na wadau katika sekta ya utalii wanasema kuwa jukumu walilo nalo katika utalii nchini ni kubwa na linastahili kutambuliwa.
Kwa nini misaada ipeaniwe kwa wengine? Sisi kama stakeholders wadogo ambao wanatuita wadogo tusipate, na sisi pia COVID-19 imetuaffect. Hatuna makazi na tuna familia.
Malindi hakuna utalii kabisa. Tutashika wapi? Hivi tunadanganywa, season inakuja. Hatujui ni lini. Hatuna chakula, hatuna fedha za mkononi. Familia tutaziendeleza namna gani? Mikakati ya kazi tutaipanda namna gani? Tumefika mahali ambapo hatuwezi kuvumilia tena. Itabidi ukweli ubainike. Kama haki iko, iende kwa mkubwa na mdogo.
Sasa tuangazie masuala ya dini, na ni kwamba baraza la viongozi wa kidini limewasihi viongozi wa kidini kufuata maagizo yaliyowekwa na serikali kabla ya kufunguliwa kwa sehemu za ibada. Askofu John Obala wa kanisa la Ngong, ambaye ni mmoja wa viongozi wa baraza la kidini, amesema kuwa viongozi wa kanisa watakaokosa kufuata sheria na maagizo ya serikali huenda maabadi yao yakasalia kufungwa.
I've appealed to our church leaders to be very conscious of time, because this disease is minimized by exposure. So the shorter the time we take, especially when infections are still rising, the better it is, and the safer it is for each and every one of us. So we have a responsibility to respect the stipulated time. In the pre-opening phase, it was 1 hour. Now it is 1.5. We just have to adhere to that for our own good as church leaders and for the good of the congregants who come to worship.
Ninaomba mchungaji, ukiwa mahali ulipo, fuata maagizo ya Ministry of Health. Hakikisha kwamba watu wameoga mkono kikamilifu, hakikisha wana sanitizer, hasa microphone. Usikubali microphone ishikwe kama hakuna sanitizer.
Sasa mtazamaji, kwa kasi lakini kwa utaratibu zaidi tunapata taarifa za spoti.